Hi, I'm Dr. Charlie Marshall. I'm an orthopedic surgeon at Peak Orthopedics. In my practice, I do mostly knees, shoulders, and hips. Someone will come in with a problem and I'll help them solve the problem, whether it's with an injection or with physical therapy or just education. Sometimes it's with surgery. So I am an orthopedic surgeon and I love doing surgery, but I also love not doing surgery. If there's a way that we can treat things with physical therapy or injections to solve someone's problem without doing a surgery. And the majority of the patients that come into my office don't get surgery. We find other things first, and then we try as much as we can conservatively, and if that doesn't work, then surgery could be an option. And I do arthroscopy, where we go in with little instruments that are smaller than a pen, and we can do alterations in the joints or ligament reconstructions, that kind of thing, with arthroscopy. And then if there's really severe damage, then we do joint replacement. The majority of people don't need that operation, but when it comes, it's a great operation and it can really change your life. Our group is especially good about getting people in the same day. And a lot of people feel like, oh, I have to go to an ER, I have to go to an Instacare, because it'll take me 2 to 4 weeks to get in to see a specialist. And we're not like that in this group. You're gonna get in quickly, and whoever's in clinic will try and work you in. We have that availability for you. We're also in a beautiful brand new hospital. It's super clean. It's got great ratings on any scale that you measure. So you have a great group coming to a great hospital. We're gonna help a lot of people.